Here at Loudon Sports Therapy Center, we see a lot of people that complain of having knee pain. In a lot of the cases, that knee pain is coming from weaknesses in their hips. So one test that we like to do here is called the 1/3 knee bend test. To do this, if my right knee is the one causing me pain, I'm going to put my weight on that right leg. I'm going to put my left foot out in front of me, and I'm slowly going to sit back in my hips and let my knee bend about 1/3 of the way. When we do this test to look for those weaknesses, we want to see that knee in line with the toes. If you come down and you notice that your knee caves in, this is a sign of some weakness in the hips and in the glutes. If you come down and you notice that your knee goes out to the side, that's also an indication of weakness in the hips and glutes and some of those adductor muscles that you have in your thigh.
So what can we do to prevent that? Well, the biggest thing that needs to happen is somebody needs to evaluate your entire leg, and that's really where an expert physical therapist at Loudon Sports Therapy Center comes into play. Somebody needs to evaluate what's happening at your hip and your pelvis, what's happening at these muscles, what muscles are tight, what muscles are weak, what happens at your knee when you walk, does it cave in? Somebody needs to be able to look at what your kneecap is doing when you bend and straighten your knee. Somebody needs to look at your calf and your lower leg, what your foot does when your foot hits the ground, and put all of those things together, because that's what's really going to fix this knee pain or this patellofemoral pain. Simply doing some stretching, not going to fix it. Simply doing some strengthening, not going to fix it. Simply combining both of those and doing strengthening and stretching, not going to fix it if we don't stop that kneecap from moving side to side. And that's really where an expert physical therapist at Loudon Sports Therapy Center comes into play. So if you're having any knee problems, understand stiffness, soreness, tightness, or if it's gotten to a point where going up and down stairs, walking, squatting are painful and uncomfortable, or even just sitting through a movie, you've got patellofemoral pain syndrome. Why not get it taken care of now, prevent it from turning into some arthritis or some bigger problems? Let us do a full evaluation on you, figure out what's going on, and get you set up for a good treatment plan to get the problem taken care of.